I had this flu, which actually turned out to be this rare blood disorder called TTP. And I was rushed to the hospital. The doctors worked on me. They couldn't figure out what was wrong with me.
I'd go home and I'd just fall asleep, or I'd get up and I couldn't get out of bed, basically. Kind of felt like having flu symptoms, but I wasn't truly sick.
My first symptoms were high fever and chills.
A lot of fatigue and hair loss and urinary tract infections over and over.
Symptoms these patients are describing are common to a diagnosis of lupus. Lupus is a mysterious and elusive disease because doctors find it to be very difficult to diagnose, and lupus patients are continually frustrated by the ongoing, debilitating pain as well as the changing symptoms of this chronic disease. Symptoms of lupus often appear, then disappear without any pattern. Our goal is to shed some light on this mysterious disease and offer up encouragement to people who suffer from systemic lupus erythematosus, also known as SLE. There are exciting new developments on the horizon. Essentially, lupus is a chronic inflammatory autoimmune disease that can affect the joints, muscles, skin, kidneys, heart, the lungs, and the brain. The name lupus, translated as wolf, may be associated with a common symptom of lupus, a red rash that sometimes appears over the cheeks and bridge of the nose that may resemble a wolf's markings. Although lupus is used as a broad term, there are actually several kinds of lupus. SLE, or systemic lupus erythematosus, is the most severe and the form of the disease that most people are referring to when they mention lupus. SLE can affect the entire body and is the main focus of this presentation. Discoid lupus is a disease that primarily affects the skin. A red raised rash may appear on the face, neck, and scalp, usually on the sun-exposed parts of the body. The rash may last for days or years and may recur. A small percentage of people with discoid lupus later develop SLE, and it can coincide with SLE. Drug-induced lupus refers to a form of lupus caused by medication. It causes some symptoms similar to those of SLE, but these symptoms usually dissipate when the medication is discontinued. Neonatal lupus can affect the babies of mothers with SLE, but is extremely rare. Here's Dr. Kathy Riker, clinical instructor at Stanford University, and Dr. Melvin Britton from the Palo Alto Clinic explaining how lupus affects the immune system.
The immune system functions as a surveillance system to protect the body from unwanted invaders. And these invaders can include things like bacteria, viruses, chemicals, sometimes even medications and pollens. The immune system is made up of a variety of different components, which include macrophages. These are cells that serve to engulf foreign invaders or antigens. It also includes T cells, which perform a variety of functions, which include releasing chemicals that can directly attack a cell. The T cell itself can work to do the same function. The T cell can also increase the production of B cells. The T cells can also serve as memory cells so that once they've been exposed to an antigen, in their memory bank is that antigen, and they will remember that particular protein in the future if they're exposed again. And B cells serve to produce a protein called an antibody, which binds in a lock and key fashion to these antigens and facilitates the clearance of the antigen-antibody complex from the body.
In lupus, a lot of things happen to the immune system. First of all, there's this tendency to make antibodies when you don't need them. And I've often likened it to, you call the fire department comes to your house, and they put out the fire, but then they spend their time chopping the floors and tearing down the drapes and so forth. So there's this overactivity of the immune system. And you see that. People tend to form more antibodies than they should. The autoantibodies are misdirected and attack healthy components of the body, producing inflammation. They also target normal healthy cells like white and red blood cells and platelets. These antibodies also attack connective tissue, which affects blood vessel walls, capillary beds, joints, muscles, skin, mucous membranes, organs, and in rare cases, the spinal cord. But recently, more important aspect is not clearing up cells which have started to undergo change, and then the body often lacks the mechanism to do this. And people whose bodies lack this essential link in the immune system are much more prone to get lupus than people who are not.
It may surprise you to learn that lupus affects more Americans than AIDS, multiple sclerosis, cystic fibrosis, sickle cell anemia, and cerebral palsy combined, yet it receives comparatively less attention.
One of the problems is that if you look at the cost of lupus as a public health problem, it isn't very great, so it doesn't surface on the radar of people who say this is an expensive disease.
According to a 1994 nationwide marketing research study, there are over 1.4 million people with lupus. 90% of lupus patients are women. Of these, Latina, African American, and Asian women are particularly at risk. Most cases first appear during the childbearing years, but the disease can occur at any age.
It was my senior year in college. I was going through my first semester exams, and I just started feeling the flu, and I was really tired.
Although lupus primarily affects women, men are also afflicted with the disease. When looking at lupus patients over the age of 50, 25% are men, and for some unexplained reason, men are often more seriously afflicted than women.
It was very frightening to see how my life was going to change. Because I was kind of just coming out of college, and I had my whole life set ahead of me, and I had something that just kind of went in and literally just devastated my life. I had no direction after that.
The cause of lupus is still a mystery. Listen to what our medical contributors, Dr. Riker and Dr. Britton, have to say.
The question of whether hormone levels and environment trigger lupus is a very tricky one. Clearly, something must be hormonally induced. Women are more likely to get it. They're more likely to get it during childbearing age. But the exact reason for that has not been clear, and probably it's because it has to act with multiple things in order to achieve what it's doing.
Lupus is absolutely not a contagious illness. There is a genetic predisposition. We do know that within family members, oftentimes we see more than one family member affected. In terms of the environment, while sun exposure does not itself cause lupus, certainly exposure to UVB rays and also UVA rays have been known as triggers for lupus flares.
The other part, the environment. Well, there are a lot of people who feel that the reason we seem to see so much more lupus is not that we're better doctors or more capable of recognizing it, but that something in the environment has changed. And Dr. Hargraves, for instance, who developed the lupus cell test, always felt that it was chemicals of some kind. Whether this is true or not is still being debated.
In rats and mice fed alfalfa, there is a higher incidence of lupus, and we do suggest that our patients avoid ingesting alfalfa sprouts.
The diagnosis of lupus can be challenging for physicians. Currently, the diagnosis may be made when a patient has 4 or more documented symptoms of the 11 ACR guidelines, although it is recognized that some lupus patients present only 2 or 3 of the symptoms. This criteria was developed to identify patients for clinical trials. These are a malar rash, a rash that runs across cheeks and the nose, or a discoid rash. This rash presents as raised and red disc-shaped patches. Photosensitivity. This is determined by a skin rash that results as a reaction to sunlight. A person who is photosensitive may trigger a flare with an overexposure to sunlight. Oral ulcers, or sores in the mouth. Arthritis, defined as non-erosive joint pain, stiffness, swelling, and redness. Serositis is an inflammation of the lining of the lungs, pleurisy, or heart, pericarditis, and can cause severe pain. A renal disorder, which is evidenced by protein or casts of blood cells in the urine. A neurologic disorder, when a patient experiences seizures, cognitive changes, or psychoses that are not induced by drugs or other causes.